and thank you for joining our COVID-19 mental health awareness video today as we discuss how consumers can overcome barriers to improve mental health. I am your host, Anisha. I am so excited to introduce Mykel Gayent, a mental health advocate, FaithNet Coordinator, and Peer Group Facilitator for NAMI Sacramento, who has also successfully overcome anxiety, depression, PTSD, and substance abuse. Mykel, thank you so much for joining us today. We would love to learn more about your story. Why are you interested in mental wellness, and what motivates you to do the work that you do?
I'm involved because 7 years ago when I entered recovery myself for my dual diagnosis, which was of course substance abuse and alcoholism, as well as just finding out that I have been suffering from mental health disorders most of my life. I decided immediately that I want to help other people understand that it's nothing to be ashamed of. We definitely have to get rid of the stigma, and I want and be able to show as an example as best I can that we can overcome these things, because I've had some trying and awful traumas in my life, but I was willing to take responsibilities for my past actions and move forward, and because of it, I've mended many fences. I have great family support, a great peer network, and I just relish doing whatever I can to help others achieve good wellness.
Thank you so much, Mykel. So you just mentioned about stigma and some of the barriers. So what are some of the other health barriers that you have faced, and how have you overcome those barriers?
Barriers for me is mostly things that I created later in my formative years. I think around 13. My life drastically changed when one of the parents was raising me passed away. The other parent pretty much turned his back on me for most of my life. I started having problems in school. I started having problems with my identity. I started feeling like I had a lack of an identity. So I spent most of my life trying to find out who Mykel Gayent really is. So now I've come to a point where I look back at everything that I've done. I take the best parts of my past, like especially when I was in the military, and determine I like that person that I was when I was in the military. Even though I was facing demons, I was very functional, and I was in a business where I took care of people then. So of course, taking care of people is a lifelong career choice, you could say. So whether it's mental health, working in administration, what have you, I want to help people.
So Mykel, how do you feel that faith and peer support has helped you with finding out who you are and with maintaining resiliency to help you overcome barriers?
Faith to me has always been something that I can honestly say that I always did have. I'm not the most religious person, because I don't go to church every Sunday. My pastor would probably tell you I don't go anymore, but I've always had a relationship with God, knowing that Jesus Christ was my Savior. I always feel that God and Jesus Christ is with me. People would say, well, why would God allow you to do these things that you've gone through? I think it's, he put you through these troubles to see what you're going to do with them. And for me, at the age of 64, I know now that I have my identity because of my faith, and I think it's very important for people to have something to believe in to get them through their times of trauma and emotional stress.
Thank you, Mike. I absolutely agree. For me also, I believe a lot in meditation and praying. It really helps me get through the difficult times. So I know that you work with NAMI. So what are some of the NAMI resources that you would recommend for us to refer to if we need help with wellness and mental health?
Well, I like to go by by what I experienced. And when I was diagnosed, I met someone who turned me on to NAMI. I went onto their website, found out that they had a class they called Peer to Peer that was starting within a matter of days, and I managed to get in. Peer to Peer is the class that teaches you about um, mental health. About, we talk about some of the major disorders, PTSD, schizophrenic disorder, and bipolarism, for which I suffer from bipolarism. I got to learn about each disorder, and then I had to learn the tools that would help me get through any traumas or emotional episode. And that's what we offer in peer to peer. And we also have uh, connection support groups, family to family support groups. We have a program called In Our Own Voice, where we bring people in to tell their stories and take them around the community to tell their stories. So there are many resources. There are 11 resources and programs that we offer, and they're all free. And all a person has to do is just go to www.namisacramento.org, and you'll learn the whole story.
Thank you so much, Mykel. We really appreciate your time today. And I will definitely be sure to check out the NAMI website for Mental Health California. I am Anisha Rao, and thank you so much to our viewers for joining today.
Well, thank you very much, Anisha. I appreciate this opportunity. And for your viewers, I hope that they look out for in the Thriver Seat. That's my new podcast.
Thank you so much, Mykel. We really appreciate you joining today.
Thank you.